Good day, everyone. I'm Erica, the moderator for this webinar. I welcome everyone to today's webinar, Understanding Payor Enrollment. I want to introduce our presenter for today. Tammy West. Tammy is the Senior Director of CVO Operations and Regulatory Compliance with the Hardenberg Group. She brings 25 years of experience in healthcare administration and 18 years in medical staff services. Tammy has a master's in healthcare administration with a minor in education and a BS in human services management.
Hello, everyone. Let's review our learning objectives for today's session. First of all, we're going to define revenue cycle. We are going to discuss payor enrollment's impact on revenue cycle. We're going to explain the basics of delegated credentialing, and we're going to understand how to avoid delays in payor enrollment. So what is revenue cycle? Simply put, revenue cycle is the process of capturing, managing, and collecting revenue for services provided to a patient. This is a diagram of the revenue cycle. So first of all, the provider is onboarded. Then they're added to the practice or the department schedule. The patient is scheduled. Their insurance is verified and authorization is obtained if it's needed. Then the provider sees the patient and documents the actual services performed. Patient copay is collected, revenue charges are captured, and a claim is generated. The claim is either paid or denied, and follow-up is performed as needed. But wait, we're getting a little bit ahead of ourselves. First things first. So prior to the start of the revenue cycle, the provider is onboarded, then added to the practice or the department schedule. This is when the revenue cycle typically begins. As you can see from this slide, onboarding delays, including delays in payor enrollment, affect revenue cycle. Period, end of story, don't let anybody convince you otherwise. Okay, so what are some common denial reasons for providers who see patients prior to being enrolled or approved by the health plan? And these are payor enrollment denial reasons. One of the ones that I see regularly is health plan, uncredentialed or unknown provider. Timely filing is another reason that we see. Timely filing occurs when the claim is submitted after the deadline set by the payor. You can always appeal the denial, especially if there was a true patient need. Revenue exercise to determine the amount of lost revenue for a provider who is enrolled with the health plan 3 months after their start date. Okay, so we're going to say the provider was scheduled to start seeing patients January 1, 2025. They were actually approved and added to the health plan's roster April 1, that should be 2025. So their lost revenue days was actually 63 business days. The average daily revenue would be between $10,000 and $11,000. This just is another graph to show the power of acceleration. So if that provider, okay, so once again, we're back to the usual suspects. Onboarding delays, particularly in payor enrollment, have a negative impact on revenue cycle. One way to avoid delays is concurrent credentialing and enrollment. Another way to decrease or avoid delays is to increase your provider enrollment staff. Okay, so in an SBAR analysis, the SBAR provides a high-level overview for leadership. It's like an executive summary. It contains 4 parts: the situation, the background, the assessment, and the recommendation. Another thing you can do to avoid delays in payor enrollment is make sure that you have software and that you are using it adequately and that it's automated. Okay, the final way that we're going to talk about to avoid delays in payor enrollment is delegated credentialing. Delegated credentialing occurs when a healthcare entity gives another healthcare entity the authority to credential as healthcare providers. The steps to delegated credentialing are you would obtain the required information, you do the credentials verification. So a delegated credentialing timeline, again, 30 to 60 days. Some of the advantages of delegated credentialing, the process and the timelines are under your control. There are some disadvantages to delegated credentialing. It is more time consuming because you're doing the credentialing instead of the health plan doing it. For final thoughts, provider enrollment can be difficult and tedious, but it is absolutely necessary for a healthy revenue cycle. Hopefully this presentation has given you some ideas on ways to improve your payor enrollment process and avoid delays to revenue cycle. That's the end of the presentation. Thank you so much for attending. I really appreciate it. And I hope that this was useful. I hope the information is helpful for you.
Thank you, Tammy. That concludes the session for today. Thank you everyone for participating. You may all disconnect now and have a great day ahead.
Thank you.